Contraception for women 100 years ago, if we're looking back to 1915, was very, very limited. It wasn't encouraged by the government, certainly not by the medical profession, and many methods were not available in New Zealand that would have been available to women in Europe. So women relied very much on old-fashioned methods such as inserting a sponge soaked with spermicidal solution, pessaries, many of which they cooked up on their stoves, or douching. The douche can was a very common implement in all households for washing out the sperm after sexual relations. In our history, there were really great changes in the 1920s, and my heroines all belong to the 1920s. They were Margaret Sanger, who introduced birth control. She invented that term in the United States. In England was Dr. Marie Stopes. Her books became very popular here in New Zealand. And Etty Rout played an important role in the First World War in encouraging condoms for prophylaxis against sexually transmitted diseases, which were very common among the troops. My own experience with contraception went back to the 50s when there wasn't very much at all. My first method was trying to use the safe times. I had a thermometer to do that. Then I had a diaphragm, and the result of that was 2 children. And then in 1961, I was one of the first women in New Zealand to use the oral contraceptive pill. So yes, my own experiences, I think, did bring a perspective to my professional work. Women's lives changed dramatically when we had improvements in contraception, and I'm thinking particularly of the pill, which really was the first method that gave us really reliable contraception, so that women could think of other things than just being a wife and a mother. Careers opened up for women because of this. I think one of the biggest social changes that affected me and the work that I was doing was feminism in the 1970s. It was a really exciting time. I remember in 1972 we had Germaine Greer visit New Zealand, and contraception began to be talked about in a way that had never been before. When I came to the university in 1969, I recognised that there was a need for contraception for the young people, and most of them were going to another doctor who had more liberal views, and I felt that it was something that we should be providing in the student health service. In the 1970s, vasectomy became very popular in New Zealand, and second only to the pill, which also was a very popular method. I became interested in vasectomy when I had my overseas leave in 1975, and when I came back from my overseas leave, family planning were very supportive, and we set up the first low-cost vasectomy clinic in Wellington. When I retired, I had done over 7,000 vasectomies. In my lifetime and in my career, I think the greatest achievement is really making contraception more mainstream, removing a lot of that stigma, and making it something that people accept as a normal part of life and feel comfortable about talking about. I would think that that is one of my main achievements.